welcome to this afternoon's event, Turning the England Vision Strategy into Reality. The purpose of today's event is to relaunch the England Implementation Group of the UK Vision Strategy, or as we're calling it today, the England Vision Strategy. Whilst the UK Vision Strategy has been going for around 6 years now, and it's made some good progress and had some notable successes, its implementation across England in particular has been rather patchy.
The UK Vision Strategy is a very high-level document, and it's all about making sure that nobody loses their sight unnecessarily, and that for people who have lost some or all of their sight, that they get the support that they need. But of course, it's great having high ideals and strategic aims. What we really need is action on the ground.
So what we're focusing on now, alongside all of the key work that's done around functional centres of excellence, is setting up regional and local infrastructures so that people up and down the entire country can benefit.
Lots to do, lots of challenges, but this is a good place to start. People have described today how there is an awful lot of enthusiasm, an awful lot to do, and an awful lot of engagement across the sector, but it still feels quite fragmented, and we've got an opportunity now to be able to start pulling that together, align ourselves in a way which is going to deliver, and make sure we're focused on what we need to deliver in the short and medium term.
So how are we going to do it? It's the difficult bit. We're going to use task and finish groups reporting to the England Vision Strategy. We'll have national groups, regional groups. We need project briefs with clear timelines, objectives for each group. The England Strategy project group recognises that we are part of the broader structure, so we will be working to, taking advice from, the UK Vision Strategy, Vision 2020 UK, and the stakeholder groups on a regular basis.
The main step that we're emphasising today is not looking at England as one a big amorphous blob, but we're looking at it as 9 regions and 27 local eye health networks and 152 upper tier local authorities and over 200 CCGs. And we're saying these organisations all need to be joined up in each local area and talking to each other in each local area, so that the visually impaired person or the patient or the person can be put at the centre of our thinking, and hopefully seamless services can be made available to those people where they live, all the way across the eye health and sight loss pathway.
All of that is highly ambitious, very ambitious indeed. But we hope that we can move from the planning stage, which is where we are now, to the doing stage. Well, the first date we came up with April 1st, but that's perhaps unwise. 31st of March 2015.
What we need is for the governments of the UK to take even more seriously the business of sight loss. It's outrageous that in a developed country, what are we, the 7th richest country in the world, it's outrageous that still today 50 people will lose their sight who didn't need to. So if we can make sight loss a much bigger public health priority, if we can make sure that people get the treatment and the support that they need, and if we can make sure that when someone has lost their sight, that UK PLC properly includes those people, then the UK will be a better place.